Hi, everyone. It's Kimberly Miller, your holistic health expert and owner of Healing with Excellence. We're here with a new episode for the Healing with Excellence podcast. And today I have a very special guest, Myra, with me. She's a nurse practitioner, a friend, a colleague, a student, all kinds. I can't even name how much we're connected. Definitely somebody that I'm connected with on every level. But I just want, she's going to give a little background about her history. She was dealing with some chronic pelvic floor pain, but I'd love for her to give it from her perspective and her history as a professional. And then we're going to dig a little bit deeper about what we did and how we rectified the pelvic floor issue. So Myra, thank you so much. I'm grateful you're here today.
Thank you, Kim. And I just have to say, I've never met a master as humble and willing to give as you are. And thank you so much for all you're doing for me, for my family, and for our whole world. It's just amazing. And I love what you're doing, trying to get this out to more people across the universe. So I think it's much needed. So
Okay.
I'll start with I'm an elder, I guess. Been a nurse for over 45 years, and I escaped the medical profession by doing end of life care. I started doing hospice work when I was about 97, I think, 1997. And so I did that as a nurse practitioner for about 20 years. And then things got too medical, and I decided to get into holistic stuff. And I think we met probably in 2016, something like that, when I was teaching belief change work. And since then, I've gone on. Well, before then, I started doing Jinsen Jutsu, which is a practice of, it's like acupressure.
Mm-hmm.
And it's a beautiful art, over 5,000 years of experience in the Japanese tradition. Love that process because it's about frequency and it's about energy. And then went with a Native American for a few days and met another wonderful nurse who did a lot of different things, massage therapy and a lot of other processes. And she helped me heal and get to a place where I could start to teach. And that's when I met you. I was teaching at that time. And I was just amazed by the work that you were doing. It was on a whole other level. And like you said, I'm a student, and that's one of my primary goals in life is to be a student. But I was born a teacher, so there we go. To get to the point of why we work together, I had an issue when I was traveling like 2 hours a week down to a job, worked 3 days, and then drove back doing hospice work. And I was staying with this friend of mine, and I had terrible, terrible, terrible vaginal problems like rash. It was all the way to my rectum. I mean, it was just miserable, itching. It was just horrible. I tried every cream, everything, constipation. It was just terrible. And so I had that from like 2009. And then you and I didn't meet till like 16. And I think it was probably 2 more years or 3 more years before I actually had the session with you. So I suffered with this that whole time. And I
Wow.
was a nurse. I knew, all there is to know about nursing. And even as a nurse practitioner, I worked with a lot of physicians. And as you pointed out many times in your sharing your crises with the medical profession,
Uh-huh.
even being in the medical profession, I couldn't find the answers. So, um, as we talked about just a few minutes ago, one session, one session's all it took. And I was on the way to healing. And right now I'm having a little bit of issues, but I know what to do for it because I've taken your class and I've done the neuromuscular testing and I just love it. And so here I am. I'm just a walking testament. But like Jess the other night, it's not something that you want to pull your pants down and show everybody. You kind of want to keep some things to yourself, but we have to talk about these things. We have to share and we have to help people. So thank you
No,
so much.
no, I appreciate you so much. And you're right. I was on that road trip and I met you in Virginia at your home
Mm-hmm.
and just to connect with you. And then we did that neuromuscular assessment, talked about a few things. And not long after, you're pretty much completely healed. And you
Hmm.
told me about it, like, Kim, I have relief. And then that's what inspired you to come take the neuromuscular restoration course and
Right.
the healing with
Exactly.
excellence practitioner course. And I'm
Right.
just so grateful to give you, relief, 99% of the time. But I agree. I just did a different podcast with a male that was having chronic pelvic floor pain. And I said, even for me, if any of my weird symptoms kick in, what's so awesome now, I know exactly what to do to get them right back in line,
Hmm.
or I
Right.
know exactly how, what to
Who to
do,
call?
to do assessment and who to call. Exactly. I'll
Right.
call Jess
Right.
and say, can you test me? Or Faith, if you were right
Hmm.
up the road, I'd have you working on me all the time just to keep us
Right.
in, good working
Right.
order, you know.
Hmm. Hmm.
But no, that's exciting. And so with that, because a lot of people don't understand if certain muscles are not working correctly and they're compressing on the nerves can cause a rash or itching.
Hmm.
Any impinged nerve can cause that. And you won't really understand that that's what's happening until you go through the manual muscle assessment and
Right.
discover that there's a compensation going on. You know.
Yeah.
And then you and I talked a little bit too, because I tell people what accelerates the healing is also just knowing what your body needs. So I know for you too, just increasing a little bit of protein, staying hydrated, just basically making yourself a little bit of a priority. Because when we're givers and if you're in the medical profession or you serve anybody for health, holistic health, you're typically giving all the time. And you're pretty good at still setting a boundary. But there's still times that we put ourselves on the back burner and forget, oh, wait a minute, I didn't eat or I didn't do this. And then that kind of delays our healing. So I was super grateful you're willing to discuss that message.
Well, I have to admit, yesterday was the 4th of July,
Mm-hmm.
and in honor of the 4th of July, I had to have a hot dog
Uh-oh.
that
Yeah, I
had a
know.
bun on it
Uh-huh.
that probably had some glyphosate on it, and who knows what else. And so I suffered last night. So, like you said, I know what to do for it. I'm
Yeah.
eating very clean today and taking care of myself and fluids. And, the
Good.
thing that was so powerful that you told me initially
Mm-hmm.
was you said, and you say this to everybody, how did your grandparents eat?
Mm-hmm.
And I was like, oh, I like the way they ate. They had meat and potatoes, they had chickens and eggs, and, she made homemade biscuits, and, it was like real flour. It was not bothered with all kinds of stuff like we have today. So that was profound for me. And then when you gave me 2,000 calories, I was like, this much? I have to eat this much? So yeah, it's been an amazing journey. So,
Yeah.
but
Well, it's
the
amazing.
neuromuscular testing, actually, we found several things that were off,
Mm-hmm.
and the constipation has pretty much resolved,
Mm-hmm.
um, which was something separate, really, from the other issue. I
Mm-hmm.
thought it was all the same, but it really wasn't. And I was having trouble with my eyes, and that was the other thing.
Mm-hmm.
Because I drove to your house one time with my eyes out of whack, and we did neuromuscular testing and found several things that were off, connected to my eyes. So it's been profound. It's really been a profound process for me and a great journey.
Yeah, I'm super grateful that you experienced that. It's interesting you said that. Someone that's known me like 15 years, that was a previous employee, she came for just like to help me with something the other day. And then I said, let's do a muscle test just for maintenance. And she's like, oh, Kim, ever since I had my colonoscopy, I have not been able to go to the bathroom. It's been like, and again, this is going to be TMI, like she's like two little tiny balls or something. And I said, oh, you know what can happen when you're under anesthesia, your body's still feeling that trauma. So to protect you, your pelvic floor muscles, the ones that surround the rectal area, could be like too tight or hypertonic to protect you. I said, you were under anesthesia, so you don't know what your body felt. I said, let's do a muscle test, see what's going on. We did a neuromuscular assessment, and sure enough, her pelvic floor muscles were working too much. I taught her what to do at home. And she literally messaged me that night. She's like, success. It was literally that one time. It's just her body needed to know it was safe. It needed to know it doesn't need to be in
Mm-hmm.
protective mode. And as I
Mm-hmm.
discussed on the previous podcast with the gentleman, a lot of people wonder like what's going to happen when they see me or they see a colleague that does neuromuscular work. They don't realize that we're not getting undressed. You're just laying on a table. There's no cover. I
Mm-hmm.
don't leave the room and say knock when you're ready or whatever. I'm going to knock when you're ready. And the one guy said, yeah, I don't even think you made me take my shoes off. And I said, no. I said, some people want to because they're scared they're going to hurt my hand stepping on it. But no. And so what's great about this, it's so non-invasive. There's
Mhm.
no like vaginal ultrasounds, there's no colonoscopies, and we find the issue just by the assessment because the body doesn't lie. And if you know how to read the body's language, like interpreting any language, you can guide it on what to do to get back to homeostasis.
Mhm. And that's been the most beautiful part because being in nursing, um, we never asked permission. We just did what we wanted to do to people. We're going to take your shirt off now. We're going to take your clothes off now, all these things. And, with this, it's not invasive at all. And we get to the root of what the problem is. We
Mhm.
find out exactly what's going on, not an inference, not, well, it could be this and it could be that. Just take these pills and it'll go away. It never
Mhm.
goes away because you don't get to the root cause. You
Mhm.
have to find the root.
Yeah.
So that's the other thing. In contrast to medicine, I loved medicine. I learned a lot, just like Jess was saying the other day. I
Mhm.
did learn a lot, and I learned a lot about what I didn't want to do. And
Mhm.
so, end of life care was a savior for me. I really enjoyed that part of my nursing. That was very rewarding. That's where I learned spirituality. That's where I became
Mhm.
very humble,
Mhm.
in the presence of people who are dying. And so I still would do that work today. And I keep thinking how wonderful it would be to marry these two,
Mhm.
marry neuromuscular testing with the end of life, so people could just ease on out or change their mind. Maybe they don't want to die.
Mhm.
Just like the ALS patient. I took care of a lot of ALS patients, and knowing what I know now,
Yeah.
gosh.
Yeah,
So
and to
moving
some people,
forward,
yeah,
yeah.
some people listening might not understand that there's sometimes a choice, or oftentimes a choice, and it is true. I mean, it's hard to believe, but I've had clients that were told they were terminal with Lou Gehrig's disease, and we addressed things that weren't being addressed, and they made a different choice, and within a year they reversed their symptoms. And that was the one gentleman was 2014, and he's still alive today in 2024, doing absolutely amazing. 10 years older and probably fitter than he was back then. And I've had that with multiple times, whether it's lupus or fibromyalgia or MS or me with chronic Epstein-Barr virus. And so it's just amazing what the human body can do if these missing puzzle pieces are addressed and the person is heard. And we look at the whole puzzle versus just pieces of the puzzle. So I'm grateful that you were willing to attend the Healing with Excellence practitioner certification and the neuromuscular because they go hand in hand. Like going through the health history, listening to the person, identifying hormone imbalances, mental and spiritual stress. And again, this can give some people the wrong perception. Sometimes we're just focusing on the physical. Other people, they really need to talk about the mental, spiritual because there's been trauma that nobody's talked about. It doesn't mean
Mhm.
anybody here is being a therapist. I might have to refer out to a therapist, but we identify that it's part of the healing process by going through these
Mhm.
discussions. And my goal as an advocate is just to say, hey, we got to look at all these puzzle pieces. If you have something chronic that nobody's been able to correct, it's going to be a little bit deeper than a one-time muscle correction. And so it's just been so rewarding to be able to experience that. And, you again, just like you say, I'm humble, you're extremely humble. And meeting you changed my life and the way I approach clients and patients. And again, people know if I'm in a crisis, I typically call Myra or like I have a lot of people in my circle that I trust to call and I reach out to them for guidance. And so if I didn't have you here, I wouldn't be doing as good as I do. So for you to be willing with your background history to be a student with me, I really appreciate that because we're helping to really change other people's lives and it's awesome to work as a team.
I agree. And I think we've got a lot of work we can do together because of our different focuses.
Mhm.
Mine has taken a different turn to the metaphysical, and I've enjoyed that part of my life too. And
Mhm.
I'm also extremely intuitive and understand when people believe something, they can change the outcome one
Mhm.
way or the other.
Yeah.
And just because mother wants you to come in and see Kim and get fixed doesn't mean it's going to happen because it may not happen. So,
Right.
if you don't believe it's going to work, it won't work. So
Exactly. Yeah. Yeah.
you
And if we
have to
won't
have the right belief.
Yeah. Yeah. If we won't do our part, and that was for me when I was told I was incurable by multiple specialists, I just chose not to believe that. And I want to touch on something you said about grandparents. For me, because the time I come from, I met my great grandparents and they lived into their 90s. And when I was being told in my 20s and 30s that I had different incurable diagnoses, I'm like, how is this possible? I'm supposedly fit. I eat right. I'm a master personal trainer. I have a gym. I'm like, this doesn't even make sense to me. But my grandparents lived into their great grandparents lived into their 90s with none of this education. My grandmother lived until 92. And at the time I was ill, she was in her 70s on one pill a day. I'm like, this doesn't make sense. So I started digging deeper. And I chose to not listen to the diagnosis of incurable and found answers, and then reversed everything that I was diagnosed with, healed my heart from 15 years ago. And a lot of people don't realize that you worked in the cardiac field too as a nurse practitioner. So a lot of people don't realize that bradycardia, tachycardia, AFib, leaky heart valves can actually be reversed by how you treat your body. Just like if the car gets water, it was overheating, it gets water, and then it stops overheating. But what I wanted to go through about the grandparent statement, what's been the saddest for me in the last 10 years, maybe 15, I can no longer, let's say someone was born in 2008, and I asked them if they know their grandparents. I can't ask them how their grandparents ate because everything changed to the processed world. So or the dieting industry. So now when I say to them, remember that they made meat, potatoes, or they didn't use the microwave, or they home cook stuff, they can't say, no, actually, no, my grandmother ate lean cuisines every night. So what's so sad is more and more people are thinking it's weird if I ask them to eat real food. So I feel like the saddest part, the last generation of people that got to live before the invention of microwaves and processed food and dieting industry stuff are leaving this earth where the truth is almost being lost. And so I really have to tell now my new clients, like, I know things changed after the war, and I know things changed in the 50s and 60s, and the dieting industry came in. So it's going to be hard for you to believe this, but people didn't eat avocados every day, and people didn't eat protein bars and protein shakes all the time, and they definitely didn't microwave every meal. So it's so different now. But with you, I knew I could say, hey, did you know your grandparents? How late did they live until? What did they eat? And the other thing that happens, I'll ask somebody how late their grandparent lived till, and they'll be like, oh, 95. I said, did they have any surgeries? No. And I said, what did they eat? Oh, they ate so unhealthy. They ate meat and bacon and rendered pig fat and all eggs. And I said, well, if they lived to
Guess what?
95 with no surgeries, do you think maybe we're the ones with the wrong plan? Maybe it was healthy and maybe we're being lied to. So anyway, what do you get with all that I just spit out?
Well, there's a lot that I get with that. My mother had a pacemaker,
Mhm,
and it was back in the 70s, I guess. And it was when the first microwaves came out.
mhm.
And so she was going to get a microwave. And the doctor said, you can't have a microwave because you have a pacemaker. It'll
Mhm.
stop the pacemaker from working. And
Wow.
these light bulbs went off in my head. It was like, what are we doing? If my
Mhm.
mother can't have a new machine in her house because of the radiation, there's something wrong with this. And I've not had a microwave. I don't know. I can't remember the last one I had. I think it was probably 2000, maybe. And I
Okay.
didn't use it. I couldn't stand it.
Yeah.
There's something about it. So I'm of the old school. I loved getting meat and potatoes and onions and eggs and bacon and sausage. And oh my gosh, yes. So
Yeah.
yeah, that was my first indication that something was off. If
Hmm.
she can't have a microwave, then I don't need one either, because there's something wrong. There's just something wrong.
Yeah.
So, and then you hear about people putting aluminum foil in them and burning the house up.
Yeah.
There just wasn't right. It just wasn't right. So
If
yeah,
something's off. Yeah, yeah. Yeah,
yeah.
in the customized cell regeneration course, I actually teach about that, about ionizing and non-ionizing radiation. And a microwave, just standing by it, you're getting more non-ionizing radiation, just like these laptops and that, where it's creating more free radicals. And a lot of people don't realize excess free radicals, which are unstable molecules, start attacking our cells. Now, again, we're going to be exposed to those our entire life, but there's so many more sources that are toxic to our body that did not exist 50, 60 years ago, that we
Mhm.
have to like honor our body that much more to fight the changing ecosystem and just,
Mhm.
look for ways to nurture our body amongst these synthetic changes in the world, because that's why we have right now 54%, one in two 20 to 30-year-olds, a little bit more than one in two, 20 to 30-year-olds have an incurable diagnosis of MS, cancer, lupus, and Crohn's disease. And that is
Mhm.
not supposed to be normal. If we had people
Right.
living into their 90s without nutrition education, without all these physicians, they didn't even have blood work back in the day, and they made it into their 90s, and we have 20 and 30-year-olds being told they can't reverse their ailment, like that's scary.
It is scary. It's very frightening. Very
Yeah.
frightening. Yeah.
Well, I appreciate you not only trusting me for your own healing process and your entire family, but also for becoming part of the Healing with Excellence team, because I'm super excited about our future reach internationally to work as a group with all
Mhm.
of our specialties and skill sets and our different hearts.
Mhm.
Um, is there anything else you want to share with the public before we close out our podcast?
About anything in particular?
Yeah, is there something on your heart that's not too crazy? Don't scare anybody away. We're already scary enough because they're already, like, what are they talking about? No,
We're
no,
already TMI.
exactly. We're definitely TMI. No.
Well, I just think that, there's a lot going on in the universe right now, and there's a lot going on energetically. And I think, like you're talking about, the free radicals, those are all physical kinds of responses to the things in our world. And I think the more in tune with our environment and our bodies and the people we're around, the calmer we can become. And then paying attention to what we eat and when we eat and why we eat is really, really important. And so I was thinking about the neuromuscular part of everything, and there's so many things that can knock you off. You
Mhm,
know, I've heard you talk about just somebody throw something at you and you throw your head back and you can get your neck muscles all messed up,
mhm,
or, you can have a car accident.
mhm.
There's physical things that happen, but there's also emotional things that happen. And so I am available to work with you in any way I can to uncover issues that may cause reoccurring
Mhm.
uh, disconnections that happened in our body. So that's just another part of what I love to do. And, you know, people talk about um, being able to decide what they want in life. You've heard about people who can avoid dying.
Mhm.
Um, what's her name? The famous woman, Morgetti,
Mhm.
who was on her deathbed. She was like stage 5 cancer, you know,
Mhm.
tumors everywhere. And she was able to change it. She actually came back and
Yeah.
decided she would. I've seen one or two issues working in the nursing profession where a woman was going in for surgery and they happened to do another scan and her arteries in her heart were clear. And the
Mm.
doctor, of course, blew it off to whatever. Well, I found out later that her church had been praying for her all night. And
Mm.
so the morning she was supposed to have surgery, she had a complete turnaround and never had to have surgery. So it's possible. It's your belief, it's your mindset, it's what you think you can do in the world. And you can do anything.
Mhm.
It's just surrounding yourself with the right people and doing the right thing for your body and your mind and your spirit. So I'm
Mhm.
happy to be part of your team.
Yeah, no, I appreciate you so much. And I don't know if you've ever read Florence Shin's book, Florin
Mm-hmm.
Scola Shin. She
Yeah.
basically was a metaphysician. And then also, we got Dr. Joe Dispenza, Bruce Lipton, which you personally know, Bruce Lipton. And then
Mm-hmm.
also, there was another person that was huge on the mind over matter. But for me, oh, David Hawkins' book, Power Over
Yeah.
Force, Power versus Force.
Right.
To
Right.
me, one of the most profound things I had to do to heal was I really had to, I say I'm in the world, but not of the world. I can be witnessing something very tragic, or I could
Right.
communicate about something tragic, but I will be always working to stay in a space of love and peace within, even if the external is in chaos, because we have to figure out how do we sustain peace amongst the chaos, because the things that are taking place to challenge us, to weaken ourselves, or to lose our peace are the things that we have to overcome, or,
Right.
to sustain a space of love, peace, faith, as much as possible. And to some people that could sound crazy with some of the trauma people are going through or have went through, but that, if I could look at what was good amongst the chaos and say, thank you so much for this, or I appreciate this, or I appreciate that you're preparing me for my next journey as I'm in the chronic condition, thanking
Mm-hmm.
God, the universe, for preparing me for my next steps, versus just crying. But I could be crying, but still truly have gratitude that whatever I was going through was preparing me for the next steps. And it's just amazing if one can do that, how quickly it aids in the healing. And on a biochemistry level, on a physical level, we have found that we release healthy healing chemicals and hormones when we stay in gratitude and love. When we're in fear, irritation, blame, shame, we're releasing more, inflammatory chemicals and
Mm-hmm.
increasing cortisol and adrenaline, making it more difficult to heal. So even if we're justified to be upset, fearful, angry, disgusted, if we stay in that space, we're only poisoning ourselves. And so the main goal is, how can we stay in the world but not of the world? And how can we sustain peace amongst the chaos? Do you feel the same way with that?
Well, one of the things that I really believe is that we're spiritual beings having a physical experience.
Mm-hmm.
And I've not to go too far with it, but Earth is the hotbed for emotions. That's
Mm-hmm.
one of the reasons we're here, is to feel. And people can feel from one end to the other, just like you were talking about David Hawkins. If you look at his scale,
Mm-hmm.
you get about halfway up before you really start turning things around.
Yes.
And when you can feel something, you don't have to live there. You can feel fear. It's okay to feel fear. It's okay to feel hate. It's okay to feel anger. Those are all okay. Just don't live there.
Right.
You can touch it, but find a way to get to love and get to gratitude and get to compassion and get up the scale as soon as possible, because it's about frequency. And another source that I've met with and know says that we are helping to expand the universe
Mm-hmm.
by our emotions, because there are other entities that got rid of emotion because they thought it was detrimental, but
Mm-hmm.
it's not. It's actually very powerful. And so it's okay to feel, it's
Mm-hmm.
okay to be, but just don't live there. Just
Right.
don't live in that space. And that's one of the things that I would love for our community to bring together, is a place where people can ask about those things and find out if it's done damage to their physical body or their emotional body or their spiritual body, and
Mm-hmm.
be able to work through it and get back to that level of gratitude and compassion. And
Mm-hmm.
one thing I wanted to say before you finish, one of the things that I've understood, and I finally know, is there's no grade for the worst case scenario or the worst illness or the worst whatever.
Mm-hmm.
And when we work together, and in your classes and in your work you do, there's no comparison. It's not like, oh, I've seen a lot worse than you.
Mm-hmm.
No, you come, we love you, we have compassion for you, we're grateful for your presence because you teach us, and we welcome everybody, no matter
Mm-hmm.
what it is. And we're
Mm-hmm.
not going to compare you to anybody else, because that's not what it's about. Because you're an entity, you're one person, you're one being, but part of the whole. And that's the paradox, is being
Mm-hmm.
able to welcome people into the community and be able to be the best person they can be. And that's
Mm-hmm.
what we all want. We want to be the best we can be, so we can help you be the best you want to be. So
No, I agree with you. And something that you said, like different things that you've been learning that I keep an open mind to is like Marlene, one of the massage therapists that I interviewed the other day, that's also part of our group. She always says, what I know is that I don't know. And it's so true. Like we only know what we don't know until we know. And so there's so many things I've learned throughout my journey that I didn't even know existed to help with healing. And I tell people, no matter what your beliefs, whether it's a biblical belief or whatever religion you practice, or if you focus on energy in the universe, they all align. And even in the Bible, it says we're self-healing. It says in the book of John that
Right.
people can heal themselves and do greater works than Jesus, even
Right.
just because they have that belief, and they're supposed to claim as though it were already it, and keep seeking and keep having faith. And so I really appreciate you sharing, because you've had, a journey over 5 decades. Now, as soon as we're born into this physical realm, we're learning. So even from when you were 2, 3, 4, 5, everything connects. But just your academic training, conventional training, and your holistic approach, I appreciate you sharing that, because some people aren't there yet. They haven't experienced it yet, or they're debating, do I want to combine a holistic approach with my conventional education, and can I do that? And that's what I love, is being able to take the positives from the conventional allopathic method and connect it to looking at the whole picture, and be able to fill in those gaps and actually give people their best possible outcome, including ourselves. Like nurses, physicians, anybody in the healthcare world deserve to feel their best if they're constantly serving other people. Most of my nurses, by the time they retire, have 3 to 5 chronic diagnoses, because they either didn't get the right answer or never got time to take care of themselves. And I believe
Right.
that each person that's been serving all these years deserves to have their best life. And then if they want to share it with others, great. That's even better.
Yeah. Jess and I were you interviewed Jess the other day. She and
Mhm.
I were in your class together, and both nurses, and we both kept saying, "Oh, if I'd have just known this when I was in nursing, if I'd have just known this when I was in nursing." But that's the whole point. We
Mhm.
know it now, and we can't go back to what we didn't know. We didn't know.
Yeah.
We didn't know. We were doing the best we could with what we had. And I think we both did an excellent job in our jobs,
Yeah.
because we were different people. We weren't of the mold of the traditional medical professional. So
Yeah.
we found it. We found what we needed, and we're still searching. What was it? Was it Buddha that said, "The more you know you don't know"?
Exactly. Oh, and I'm grateful that even if I've been slightly skeptical to something, I've kept an open mind, because I've been proven so many times that I don't know. And so I try to really hear it out. Sometimes like, that's crazy. And then I'll follow it for a while. I'm like, oh, maybe it's not so crazy. But because, it takes time for our subconscious brain, as you know, to wrap our brains around these new things that we're being introduced to. Well, I love you, Myra, and I appreciate you. And I'm grateful that we became connected.
Me
Um,
too.
yeah, and thank you for helping me make a difference in the world.
Thank you for dragging me along.